Kul att det är så många här. Nu ska vi se. Jag heter Elin Hedbrand och kommer att moderera det här första seminariet. Och anledningen till att vi startade det här Experio Exchange var för att dela goda exempel på projekt som har gjorts runt om i landet, i regioner och kommuner. Och framförallt dela lärande och kunskap hur det är att arbeta med design i offentlig sektor. Och nu till dagens presentation. Vad tänker ni på när ni hör ordet preventiv vård? Eller förebyggande ord? Eller förebyggande vård? Ni får gärna reflektera kort för er själva eller skriv någonting i chatten. Ni ska få höra om ett spekulativt designprojekt som handlar om just det. And this presentation will be held in English, but the discussions afterwards will be in Swedish. So very welcome to my colleagues from the region of Stockholm and SES Innovation, Pom and Maria, with Exploring the Future of Preventive Care.
So yes, nice to be here. We're Pom and Maria, and we're colleagues with Elin from Södersjukhuset, or the South Hospital in Stockholm, which is one of the biggest hospitals in Stockholm. And we're here today to present our project, the Center for Preventive Care, which is very exciting. So we worked quite long with this project, but it ended 2022. So now it's been a while. So very happy to be here. And the project is about exploring the future of healthcare. And more specifically, we have explored how a healthcare visit could look like if our healthcare system was more built on prediction and prevention. And this project was funded by Vinnova, which is Sweden's innovation agency, and we responded to their call, Future Prototypes. And in their call, they wrote, future prototypes aim to make possible future more concrete so that we can better imagine the futures we want to exist, how we can get there, and how we can avoid futures that we don't want to create. And our aim was with this that we wanted people to reflect upon the pros and cons of a healthcare system built on prediction and prevention. Because today the healthcare system facing a lot of big challenges, there's an increasing demand, we have a lack of staff, and we also said to rethink how the healthcare system should work. We talk about close care and we talk about prevention, but it's really hard to know like in which direction we should go and how should this really look like. So what is prevention and what do we mean with close care? So we wanted to explore this a bit further and make a scenario in the future so we have something to talk about. And we think speculative design is a very strong method in doing this, that we create something really concrete so we have something to discuss. Is this the future we want or is this something we don't want? But then we have something that we can talk about that is concrete. So this was the aim of the project. This is the team. So this is Paul Maria, me, yes, and Clara in the middle, which is our colleague and a graphical designer. And we also collaborated with Baptiste from Bloom Type Foundry on doing all the technology in the installation. And normally we work with service design, so this was a project that is a bit different from what we do normally. We also had a girl, Nora, in the project. So she was a student from Konstfack that joined the project also. So we will now show you the results from the project. So we'll start to guide you through a bit the installation we did. And the installation took place in November 2022 at Södersjukhuset in the main entrance during 1 week. So then we put up this preventive care center and invited people to come and visit us. So there were many visitors, people that worked here. So there were staff passing by. There were also people invited coming from the outside, like students from different schools, but also patients that passed by. So something that was very important, because this was fictional, of course, that people would really know that this is not for real, because we have a big responsibility being in a hospital. So we had to make sure that they know what they were entering. So we had them to sign this form, and we stood there informing this is a future scenario, this is not real, but we want you to explore a bit the future and try it out in another way. Yes, so this is how it started, and then we invited them into the installation.
Yeah, and then when you see the installation, it's made out of, it consists of 3 different stations, and they were numbered. And we worked with actors who played the role of staff in our preventive care center. And first, visitors were invited to the first station, and they started with taking a genetic test. So they would swab the inside of their cheek and place it into the table. Then the second test they had to do was that they had to place their phone on the table. And this table was interactive, so it showed all the time what information was being read, what was being uploaded, and for what diseases it was scanning for. So in case of the phone, you could see on the table, okay, now we are downloading or we are uploading your voice patterns, your whereabouts, your purchasing history, your social media activity, everything that could tell something about your lifestyle. And the third test that people took was that they swallowed a microsensor, and the sensor would send data from their gut about their gut bacteria to the table. And you could see that it would be reading for connections to certain possible diseases, such as depression or Alzheimer or IBD. So then when the visitors were done with the examination, they were welcomed to meet the oracle. And the oracle is an all-knowing AI that would speak to you via headphones. So here you see a visitor sitting there, having the headphones on, listening to the voice of the oracle. And the oracle would give some kind of health prediction. So she would tell you what's likely to happen in the future for you and what you could do to avoid her prophecy. So for example, she could tell people that, okay, you are taking too much risk in life, and it's very likely that you're going to get a traffic accident. So you really need to get more cautious. Or she could tell someone that, okay, I see that you're gonna die 8 years earlier due to chronic loneliness, and you really have to start prioritizing your social connections. Or she would tell you, well, your lungs are your weak spot and you are too much exposed to air pollution. So you have to just leave the city and move to the countryside. Those are some examples of what the oracle could tell people. So after they had heard their prophecy, they would receive a small prescription. And this prescription would be for a pill that would help people to change their behavior exactly according to what the oracle had told them to. And this pill could be taken out in the last station, which served as a pharmacy. And here you see that there was 4 different pills that we created. The first pill was saccharophobia. And when you would take this pill, it would make you immediately very averse to anything containing sugar in it. Then there was a pill, caution, and this pill would make people adapt a very cautious and behavior, very alert to danger. The third one was friendship ability. So when you would take this pill, you would be much better at creating social connections and meaningful connections with others. So very handy if you were at risk for the chronic loneliness. And then the last one was biophilia. And biophilia was a pill that made you immediately very attracted to nature. So the pharmacist would give this pill to the visitor, and she would also tell immediately that you have to take this pill within 24 hours, otherwise it will be reported to your region. And here you see the bags in which the pills were packaged. So someone would receive one bag with a pill in it with some instructions on how to take it. And also these bags had a small description of the project and the website of the project on it. And this bag kind of served as a memory after the experience, because people that came out of it, everybody had a different bag, so it also functioned as a conversation starter.
Yes. And after the healthcare visit was done, so then we invited people back into the now, and they were encouraged to engage into reflection. So both with us and with others. So we were standing in the end of the installation, and we had 4 questions to guide a conversation in which people were asked to take a stand. And the 4 questions were like, how much data would you share in return for personalized health advice? And then they could say nothing, privately please, or everything, no problem. The second one was, would you want to know your future health risk if you could? So no, ignorance is a bliss, or yes, knowledge is power. Or how would you feel about an AI being your healthcare provider? And the last one was, how much of your lifestyle would you be willing to sacrifice for perfect health? And these questions were then connected to the different stations in the installation. And the reactions varied widely. And some people were very hopeful. We got people very excited. Oh, when are you going to open for real? We got a lot of people to say in the hospital, which was a bit fun. And there were a lot of people that appreciated the efficiency of the AI and that it was very anonymous in the process, while others felt that it was very impersonal, that they would rather have a real person to talk to, that they want this human connection. We also had a lot of prejudices around elderly people that they proved us wrong. So there were a lot of elderly that really appreciated this AI doctor, which was interesting. And we had a lot of dialogues around less common factors of health that people didn't really know about, like, for example, loneliness, that it has such a big effect on you. So there was a lot of people that didn't really know that. But I think also most people expressed the desire for personal autonomy, that they were reacting quite strongly on this, that the government would then come back to you if you didn't take the pill or if you would behave badly or unhealthy. And there were a lot of also quite deep discussions around, like, what is a life worth living? I mean, you can be very healthy, but then maybe you sacrifice too much. And then what life would you like to live? And what is worth to live long or to live a life you want to live? And also a lot of people approached us afterwards, which was fun. So even though they know it was fictional and that we had no real pills or anything, we heard stories about people reaching out on LinkedIn, trying to find friends, or gather old friends to having a dinner, or a girl that bought a helmet. She got this caution pill. So she started to reflect that, oh, I don't use helmet when I bike. Maybe I should be more cautious. So it was very interesting that it still affected people somehow to go through this process. And I think one of the favorite answers we got was that I never thought about that. And I think that was our purpose also of the installation, that we wanted people to reflect about questions that they normally don't. So then we felt that, we did something, that we raised questions that they wouldn't think about normally. And we also made a film to capture the experience, so that you can also find on the website. We will show you a bit later if you want to hear more about people's thoughts. Yes.
Yeah. So now we started by showing you the installation, but we thought for this occasion to share more with you about the process behind. So how did we get to this end result, and what are all our thoughts and decisions that lay behind? And to do that, we thought we start by introducing you to the methodology that we used, because maybe it's not a familiar way to work for everyone. So futures thinking is the methodology behind the project and our approach. And to think about the future is often a familiar and individual process. We all do it all the time. You might already be thinking about what you're gonna do tonight, or maybe you think about your next summer vacation, or maybe about your pension. Like, there's different time scales in which we can think. And you understand that when we try to envision these long-term futures, and especially when they become less individual, but they become more collective, such as thinking about the future of healthcare, or the future of education, or the future of transportation, it becomes more complex, and we need more tools and strategies to be able to think through these different futures. So when we talk about futures thinking, it's about thinking about the future in a constructive way. So we use different tools. So a couple of examples of tools are, one thing we did was you can take a trend or a signal, something that you see happening today, and then speculate what would be the consequences if this trend becomes bigger. And then you can go on and think what would be the consequences of the consequences. So you can sort of map out where we might end up and come to things that you maybe didn't expect in the first place. Another important thing is to think in different directions. The future, sometimes we think about the utopian or a dystopian future, something that's very positive or really negative. But of course, in reality, there's many possibilities in between. There's a whole spectrum of possibilities. And when you think also about our installation, the Center for Preventive Care, it's not really a utopia or a dystopia. It's some kind of reality that maybe triggers negative emotions or positive emotions, also depending on who you ask. And it has the potential to trigger a more nuanced ethical reflection. This is a quote by Dunne and Raby, who coined the term speculative design, which I think says it quite well. That whereas it is accepted that the present is caused by the past, it is also possible to think of it being shaped by the future, by our hopes and dreams of tomorrow. Because as human beings, we have this possibility to envision a future. And when we do it and we articulate this future, it affects what we do today, and it affects the decisions that we want to make. And most of us will think of time on a timeline. We think there's the past, there's the present, and the future. But when we work with futures thinking, it looks more like this. We take into account that there is not one future out there. There is many possibilities of futures that could happen. And it depends on trends. We have counter trends, can go in different directions, but also decisions that we make that impact it. And there's many uncertainties that we could take into account. And there's a couple of reasons why you would do this. One thing to think about these many possibilities is to be better prepared for certain scenarios, but it can also be to be able to discuss, is this what we want, or do we want it more like that? And in that case, what are the decisions that we need to take right now to get there? So then to create a future prototype is to provoke thoughts and feelings about the future. So the future is open, but it's not empty. So this future scenario we created is not just something that we out of the blue came up with. We actually worked with the informed imagination. So first we got informed by trends, by looking at evolving research, by new technologies that are being developed, by socio-cultural shift, new behaviors we see that people are adapting, everything that we think, that hints us towards a possible future. And then we used our imagination to imagine where these developments may one day lead us.
Yes, and now we're going to share some trends and signals that we based this project on. And like Pom said, so we initiated a project, and like the biggest part of it actually is the research. So we read a lot of articles, watched a lot of documentaries, and we met researchers in different fields and read books and listened to podcasts. That they were really like an extensive research that is behind the project. So we're going to share some of the signals that we found. And first, we have something we call mega trends, which is trends that we know is going to happen. So this is going to have an impact on the future. So it kind of laid the basic ground for the product. And one of them is the rise in lifestyle-related and chronic diseases. So that's something we know is coming, and it's already here. And it's a big global public health issue. So for example, in Sweden, more than 85% of the total healthcare budget already goes to treatment of chronic disease. And we see also that chronic patients use like 4 to 6 times more care than other people without the chronic disease. And we also see this raising demand for healthcare. and also available staff that we don't really have. And this gap is expected to grow because of the aging population. And in 6 years, close to 25% of Sweden's population is also predicted to be over 65 years of age. So this is something that we need to think of, like how we're going to rethink the system, how to handle this new situation. And we also see that many of the chronic conditions are driven by lifestyle factors, and that also could be prevented. That's why prevention is very interesting. And we also see that today that healthcare, the system focuses more on reacting to symptoms rather than preventing disease from breaking out in the first place. But now calls for a shift in this precision medicine or more preventative services. And also personalized care is also on the rise, especially in research. But meanwhile, there are also great advancements in science and technology around improved health, and we also live longer, and there's a lot of new research that's breaking biological limits, that we have a lot of possibilities and research going on in this area, which is also very interesting to look at how can this affect the future. So now we're going to show some signals, which is more these small movements or things that we found that can have a bigger impact in the future. So one thing we found was, for example, in Estonia. So in the first station in the installation, we asked them to leave a sample for examination, for example. So there were a sample consisting of this genetic sample and also the digital sample and this microbacterial sample. And also, so this genetic testing, we can see that it grows bigger, and we have a lot of companies offering insights into medical risks in return that you send in your private information, like your genetic code. So you swab and you then send it to the company and you get the result back. And we also found that, for example, some countries like Estonia, so they have organized this on a national level. So 2022, already 20% of Estonia's adult population had joined this program and then send their genetic codes in. So they're collecting it nationally. So while these initiatives hold potential for tailored treatment and preventive care, there's also a lot of concerns about this data safety and security and ownership that is emerging. If people starting to send the DNA to companies, what happens then? Or is this something that should be organized from the government?
Something else that we see is that already our smart devices are able to collect a lot of data about our lifestyle and about our behaviors. And this could be potentially used for early detection of diseases. So one example we found was this Chinese AI that could predict suicide attempts. So it worked that this AI would analyze people's social media accounts, and it could detect certain keywords that would indicate suicidal tendencies. And then they worked with a network of volunteers that would be maybe close by, living close by these people that were at the risk of committing suicide, and they would go to these people and try to avoid this from happening. And in the first 18 months, they saved 10 people's lives every week. Then another example is about vocal biomarkers that is seen as a new opportunity in prevention. And this means that actually the tone of your voice or the pitch, the rhythm, the rate of your breathing could be analyzed by an AI and also detect very early symptoms of certain disorders, including Parkinson's, cardiovascular disease, and post-traumatic stress disorder. So you can imagine when we have more voice technologies around us, such as Siri or Google Assistant or Amazon Alexis, we're going to have a lot of this data that could be potentially used to very early on already detect these conditions. And then the last example was the smartwatch that can spot Parkinson's 7 years before key symptoms appear. So the smartwatch could measure or identify when people's walking patterns somehow changed and would indicate very early symptoms of Parkinson's.
And in the second station in the installation, so visitors got to meet the Oracle, and the Oracle then warned them about various conditions based on risk. And behind this station, we have found a lot of articles around that medical decisions are already being influenced by computer calculations today. So one case is the one with Angelina Jolie. Maybe you know about it, some of you. So she underwent a preventive surgery after a genetic test that indicated that 87%, she had 80% risk of developing breast cancer. And then she decided to remove her breast to prevent that she would get it. And we see also that technology allows for the detection of quite small abnormalities, but there's also a lot of concerns around arise like regarding healthy individuals that then would detect something that is not really going to develop to a problem who's going to become cancer, and that it would create unnecessary anxiety and then expanding the treatment industry. We can take the next, yes. And we also see this as new knowledge is continually gained about health threats that they're quite overlooked. Like we have, for example, loneliness. It's not really something we talk so much about. We talk about food, but then we found some research that loneliness can be linked to a reduction of lifespan comparable to smoking 15 cigarettes a day. And we also found that cognitive decline is also associated with lack of social activity and also the consumption of ultra-processed food. And also noise pollution is something that is increasing in the society, and it has a strong link to cardiovascular disease and also type 2 diabetes. And it also becomes an increased risk of heart attacks. And this is also something we don't really talk so much about. And then nature. So we also had this connection to air pollution that the Oracle told people about. And it's a major cause of premature death and disease. So representing the largest environmental health risk in Europe. And you can already get spending time in nature on the recipe. And air pollution is also connected a lot to climate change, and this gets also worse in the world. Yes.
Yeah, then when we get to this last station where people receive the pills, there was some underlying research and signals there as well. So one thing is that we're gaining more and more understanding of the human microbiome, which is the bacteria in our gut. And also that we know more that it has connections to both our physical as well as our mental health. And more, it is common to have like a transplantation of gut bacteria, and that this can really help for certain diseases. So something that we were really intrigued about was this research we read about mice. And what they had done is that they had taken two mice and they swapped their microbiota. So there was one mouse that in the beginning was very timid and the other one was more extrovert and bold. And after they had done this transplantation of gut bacteria, their personalities actually swapped. So the timid mouse became very bold and vice versa. So this also indicates that actually there's a link with our gut bacteria to our thoughts and our behavior and personality traits. And it goes even further that we also read an article about a human being, a guy who had also took the gut bacteria of someone else because he had problems with his stomach. And then after he had done this, his symptoms disappeared. But what he all of a sudden got was that he craved sugary things, and he didn't have that before. And when he asked his donor, he found out that the donor indeed really had a sweet tooth. So this made us think, okay, we can do it the other way around. You could create possibly a pill that make you very averse to sugar. So what if this pill would contain bacteria that would actually affect how you think and what you are craving for? Is that something that we would want and that we would take, or would that go too far? Then we also looked into research around placebos, and we were intrigued by this small randomized trial about open label placebos, which means that it's a placebo that you take, and you know also this is a placebo. And still in that case, it worked on people. So this made us also get the idea that it would be interesting in this installation to give people a pill that could hopefully actually have an impact on them. And which the thing that Maria already talked about was that it did happen in some cases, that people actually started to behave according to the pill that they received.
Yes, that was the first step, the biggest step of doing the research. So now we're going to take you through the following steps of how we did the installation. So we started with formulating what-if questions, like Pom talked about. So we started an internal workshop with the whole team. So looking at the signals and exploring then what interesting questions they were raising. So where were these articles hinting us towards? What kind of future? So we then began to formulate thought-provoking what-if questions to envision their potential impact on individuals and society. And we have some examples on the next slide. Yes, so here, for example, what if data is a new religion? Or what would you want to know if about your future health? And how does an extremely healthy society looks like? So we played around with a thought like, what if being unhealthy would be a crime, for example? How would that society look like? So we were looking a lot about the tensions of, for example, knowing versus worrying, but also this privacy and free choice, and also access to superior healthcare. So there were a lot of interesting tensions that we could explore in this. But also this, like, what if Oracle is a company or if it's a governmental institution? What would make the difference? Yes, I could then take the next.
Yeah, so then after we picked some key questions from this, which was hard because we had a lot of different possible questions to work with in this project, but we chose some, and then we created various concepts and future scenarios. So we started to think, okay, how could these questions be raised in a way to our audience? And then somehow naturally this idea for a preventive care center and for a modern Oracle came up. And what we decided to do quite early was to start prototyping. So in one day, we made a prototype that we then tested on some of our team members. And here you can see that there's already some very simple paper version of some kind of place where you could leave your samples. We thought about, okay, what is the first thing that people that visit us will see and read? What is the kind of language that we will use? In this first version, there was an Oracle declaration and dedication form because it worked also with an implant that people would receive. And here you see on the picture also that I am in this case acting out as an Oracle and receiving my visitor. And this was a very powerful way to start working. I would recommend everyone that works with a future prototype to start, just try it out early, because a lot is about the interactions and how another person will interact with your future prototype. Just do it early because it gives you really a sense of what works and what doesn't work. And when we started here from this on, we iterated on this journey and improved it every time. And then at some moment, we also tested it on a real audience. So we went to a conference on precision medicine that was organized by Vinnova. So this conference had gathered all people that professionally worked with precision medicine. And you see we made an isometric drawing of the installation that we just put on the table, and we had some real elements on there that people could interact with. It's a short video where you see we had a lot of people visiting us, going through it. So they would also put their phone on the paper drawing. They would pick up the headphones and listen to the oracle. And we were surprised actually how with such simple means it could create a powerful experience. It was even so that people thought it was scary to put their phone on the drawing.
Paper.
And when they heard the oracle that would maybe tell them something that would really resonate with them, they were like, how do you know this? So we noticed that by simple means, you can really test out an experience quite well and then see what kind of discussion is it creating? Is this what we want, or should we steer things in another direction? So something that we spent quite a lot of time around was the oracle and how to design this oracle. Because we knew we wanted one, but not yet how it would appear. And we thought, is this going to be a person? Is it something that's visual? Is it just a voice? What is it? And we were wondering also about the identity. Should it be more scientific and maybe telling you what risk percentage you have for certain diseases, or should it be more cryptic? And we looked a lot at Greek mythology around these Greek oracles in the past, and there they used actually this very cryptic 3-sentence structure to tell their prophecy. And in the end, it became a little bit of a mix where we ended up. We kept a bit of this mysticism in it. And then you see also on the picture there that the first version was actually that the visitor would be standing and listening to the oracle. But then we found out that this was too exposed and didn't feel intimate enough. So then we decided to create this small booth that you really can take a moment to take in this message. And it was, for example, important how high this booth would be, so the next visitor would not interrupt you, but could slightly see, okay, there's somebody in there, it's occupied. So details like that. And then it was also about the actual message that the oracle would tell you, like what health issues should she bring up. And that's a lot of the research that went into that. And also we had to take into account that we are at a hospital and we didn't want to make people get too upset. So we, for example, avoided to place in conditions or diseases like cancer. We didn't want to talk about that because it might be emotionally distressing. So we had to find a balance between sending out a powerful message and making something that would create an emotional impact on people without it being distressing. And in the end, these oracle messages, they function a bit like a horoscope. So most people can find something in their life that resonates with them, and therefore it evokes a genuine experience. And also we wanted to broaden people's awareness around preventive care. So we didn't want to talk only about food and exercise, which is maybe the thing most people think of with preventive care, but kind of talk about these lesser known health impacts. And then the pills that we created, in the end, it was 4 different pills. You see in a first version of the pills, we included much more side effects written out on the pill pod. So it was much more telling the visitor what this pill would do to you. But in the end, we kept it quite simple and just 1 sentence telling about what this pill would do, because there was anyway already a lot of information to be taken in the experience. And then the graphic design was really looking at, okay, how it should be something that people recognize as a medical label, but we also wanted to include this touch of mysticism that goes well with the oracle.
Yes. And then creating the experience was very important, that it would feel that it was for real, even though it wasn't. So we worked with a lot of technology, which was Baptist's part. So 2 out of 3 stations incorporated technology. So for example, the first one where you were leaving samples were the most complex one. So then it had to both detect when someone placed a DNA stick, like in a hole. So we had to create sensors that would sense when you drop it down the hole. And you were also placing your phone on the table. And then you would want this text to start reacting to the phone that it was downloading. So we had this text about now we download your emails, your conversation with friends, your photos. So then you would get instant feedback from putting your phone on the table. So we would experiment with different types of plastic, for example. So it has to make the projection visible in different lights, but also the surface needed to detect that the phone were lying on the table so the camera could see it from underneath. So then, for example, with this hole where you put the stick, we had to both combine like infrared distance sensors, but also video image detection. So they would sync and then see, okay, now we have something, and then it will start ticking this feedback on the table. And then the second station consisted of 2 buttons. So we had both Swedish and English, and we also had it connected to a digital printer and Bluetooth headphones. So this was also programmed to deliver different prophecies to each participant. So it was randomized, but we had to sync it so it printed a related prescription to what you have heard. But we didn't want it to be like the same prophecy coming after all the time. So we didn't want this pattern. So we wanted to randomize it, but still keeping the message as far apart as possible to get a sense of uniqueness. If there were a lot of, like a big group of people and they would discuss, like not too many would have gotten the same. And we also needed to consider that we need to transport everything every night because we couldn't really leave it in the main entrance. So we had to take everything to another room. So it also needed to be able to handle this. So the sensor needed to be quite like stick to it, and it shouldn't be too fragile. So there were a lot of aspects around the technology that took a lot of time to fix. But we're very happy about the end result, and it worked in the end mostly. And then in the last station, we had these questions that we posed to the audience. So we had a dialogue and reflection in the end, and it was also the most important part in this installation, to tie everything together. So we believe that it was important to then guide the audience into providing them with these provoking questions, because it was quite a lot to take in, and it also helped them to place the experience they just had. So we narrowed it down to 4 questions that linked them to the topics then that we addressed in the stations. So we played around a bit with if we would collect it digitally at first, that it is something that we want to collect what people think about these questions. But we also then felt that the most important part is installation, that it would also be like another screen that would be a bit too much, and it would take a bit too much space, so that the experience would be the most important part. So in the end, we decided just to then have the question printed in the end, and that we would make people to reflect upon it in the way they wanted. So we decided not to collect their answers. Yes, and before the opening, so we made sure to hang posters with thought-provoking questions around the hospitals. But we also sent out invitations to people, different students or classes, or then just in our networks. Yes, and then after the installation, so we also were invited to have a workshop with managers at our hospital, which was very exciting. So then we also created a workshop based on the installation. So we had all the managers in the hospital, 220 for 2 hours or something, that we then they were asked to relate the different what if questions to their own ward. So then they were reflecting upon the system in which we work. So we took it more on a system level, more that the installation was more personal, and then we kind of were also, so we lifted to more system levels. So we were asking, for example, what if AI and digital humans had the competence to work as hospital staff? Or what if the role of the hospital was to help people to do healthy lifestyle choices? Or what would that mean to society, for example? So then based on these what if questions, they then reflected on, so what would that mean for society, or for the hospital, or for your workplace, or your role? So then it became very concrete, also connected to their actual work that they do today. And this workshop we also shared, so I know it's also been used by others. For example, there were nurses from Norway that went through this through Experio Lab, which is also very exciting that it's could be used of others too. But it was a very interesting way for them also to reflect upon the system, and they were very happy about this workshop, that they felt it's not so often that we can reflect upon these questions, that it's very easy to get stuck in what's not working, we don't have budget, or it's always the same problems, but this was able them to lift a bit and to think a bit freely about the future of cardiology or hospital management. So yeah, it was a fun workshop to do. Yes, and we got a lot of interest from others, which was also very exciting about this project. So we invited, for example, to the National Conference of Close Care, which is the picture to the left. So actually, this was clashing with our week of installation, so we had to take the whole thing, but we decided it was worth it. So during one day during this week, we shipped the whole installation to another part of Stockholm to be there for one day to set it up and then back again. So that was also a bit scary with all the sensors and technology. Would it work? But it was very exciting to be there and to talk about with all these people from different regions and to meet people also working with the future of healthcare. So there were a lot of interesting discussions there. We also presented a project at Vitalis, so one of the largest conferences in the Nordic connected to e-health. And then we also nominated in the Sweden's biggest award, Design S, in the category of design for systemic transformation. So that was also very exciting. So we got the chance to spread it also through that channel. Yes.
Mm-hmm.
And then after that, so we've been working. So for us, it was very important. It was quite a lot of work to put it up. So then it was also always the thought that we would document it in a good way so it could be used, so the documentation. So we spend a lot of time in documenting the project. So we have a website where you find both most of the things we talked about today. So we have all the signals and we have pictures, and we made a film that would then take people through the installation, and you can also hear people sharing their reflections in there. So the website we put up quite recently, so we spent quite a lot of time in making it good afterwards. So we put it up just before this summer. And then we also have this part that is called Take a Stand that you see up to the right. So now afterwards, we wanted to start collecting these answers that people think about these questions that we raised in the installation. So we separated from the installation, and we felt it would be interesting now to then starting collecting it afterwards. So we would be very happy if you want to go into the website and answer the questions, and hopefully it can become a discussion around different perspectives. So there you can then answer, you can also see what other people answered in the different questions.
And we thought to end our session with this quote by Rose Evelett. She says that the futures that get imagined depends largely on the person or the people doing the imagining. And this is maybe the key reason for doing such speculative design project, is that you can invite a broad spectrum of people into a dialogue about something that concerns us all. Because we often think that the future is something that is driven by technology, or that the tech sector determines where we are going to go. But it's really important to have more of a democratic dialogue about the futures that we wish for or that we don't wish for. And we hope that this talk also inspired some of you maybe to start creating your own speculative design project and include different people into the conversation about the future. Thank you.
Thank you. That was it. Thank you for coming and listening.
Tack. Och tack så jättemycket Maria och Pom för att ni kom hit och för att ni har delat. Otroligt vilket arbete bakom. Jag har ju ändå fått se er kämpa med alla dessa prototyper och tester. och sen också se utställningen. Det har kommit in lite frågor i chatten och alla är välkomna att skriva några fler reflektioner eller frågor som ni har till Maria och Pom nu när vi har dem här. Vi har lite tid kvar för att hålla en diskussion. Så kommer ni på några saker som ni vill skriva så är det bara att lägga dem i chatten. Och jag tar lite hjälp av Matilda. Jag tror att det har kommit in redan någon fråga eller någon reflektion som vi skulle kunna lyfta från publiken.
Yes, det är ett gäng här. Och jag vet inte, var ska vi börja? Men jag tänker vi kan ta den som David har frågat här. And related to the above question, eller den här, förlåt. Men vad den här workshopen med ledarna, jag tar den på engelska. Was the workshop with the managers as immersed as the experience? Do you feel that they felt the questions emotionally or were they in their heads?
Good question.
Yeah.
I think they were probably more in their heads because they hadn't really sensorially, they hadn't experienced the installation themselves. And I think that, of course, is something that does make a difference. When you go through something, you swallow something and you put headphones on, you will probably relate to some questions differently. We did ask the managers also in the end to step in the role of a future patient, though, and we asked them to write a postcard from the future. So maybe they got some aspects of stepping into the role of someone from the future. But definitely, I think we managed to trigger them a bit to get into it, but not as much as if they would have been there.
Intressant. Och lite relaterat till det så har David också frågat den här frågan. Vad har ni sett för effekt på SÖS? Och har ni sett någon effekt på ledarskapet på SÖS i och med att ni har gjort det här arbetet? Och kan ni se några förändringar i hur de tänker sig framtiden för SÖS? Eller har ni hört någonting?
Oj, svår fråga. Jag tror vi har inte riktigt access till de forumen tyvärr. Men de var ju väldigt exalterade över det vi gjorde. Men sen är det ju svårt att veta riktigt vad det var de var exalterade över. Men det var väl lite det jag sa, att de kände att det var ett verktyg som hjälpte dem att öppna upp. Att de kände sig väldigt fria från att normalt sett sitta och liksom kämpa med samma utmaningar eller komma framåt till att liksom ha en väldigt kreativ diskussion. Så jag tror många är väldigt inspirerade, men sen vad det faktiskt blir i slutändan är nog svårare tror jag när det ska ner i verksamhetsplaner och då blir det väldigt kortsiktigt. Så att vi har inte fått direkt så mycket återkoppling på något som har ändrats, men vi hoppas ju att ändå de har fått någon typ av tankar som kan sitta kvar i hur de tänker kring vissa frågor. Men det är väldigt svårt att spåra.
Tack. Jag tänker ni kan skriva i chatten, men ni kan också räcka upp handen så kan man ställa en fråga. In person så att säga.
Jag ser att Thomas gjorde ett inspel att spekulativ design bjuder in till diskussioner, insikter, funderingar, behov och förväntningar och mycket mer. Håller ni med om det? Eller vad ser ni för stora fördelar med att just använda spekulativ design som en metod?
Jo, men det är väl lite, det har ju lite olika syften tänker jag. Att tjänstedesign handlar om att göra tjänster bättre. Syftet med spekulativ design är ju just dialogen, diskussionen och reflektionen. Så att det är lite olika saker. Men vi upplever ändå att det är väldigt kraftfullt och att det var väldigt kul att från att vi stod i huvudentrén och folk var lite så här, vad håller de på med? Till att vi ändå fick någon typ av förståelse när vi höll den här presentationen för chefen att de var otroligt liksom, inspirerade och engagerade. Så att vi ser det lite som vårt genombrott här på SÖS. Att folk förstod liksom lite vad det var vi hade gjort och att de upplevde att det var väldigt värdefullt. Men sen är det ju väldigt svårt att sätta ord på exakt vad det har lett till. Det var väldigt uppskattat, så det var kul.
Det var ju också lite kul att det var några som inte ville göra det för att det inte var på riktigt.
Ja, exakt.
Ja.
Det var väldigt kul att folk kom dit och verkligen önskar att det här var nutiden. Men jag vill veta mina risker. Är det inte på riktigt så vill jag inte göra det.
Nej.
De tyckte att vi kunde ordna att det finns. Så det var kul.
One reflection also when it comes to presenting to the management is that it was very important that we had enough time to present it, because we had one moment before where we could pitch sort of what we were about to do in the main entrance, and we had maybe 5 minutes to present it. And then we noticed that it was taken by some with some skepticism, and maybe not everybody understood really what this is about, because it's a lot to take in if you've never heard about this method. So it was very important that we got enough time with the management to also tell them about the methodology, about the trends that are behind it, that they're not just thinking, oh, it's this innovation department again that's coming up with fun stuff. That it's really thought through and grounded. So if you're ever in the position where you have to convince a management group, it's good to make sure that you have some time to really explain what you're doing.
Nu ser jag att det trillar in lite fler frågor. Matilda, vilken börja med?
Ja, men en intressant, och först kan jag bara säga att inspelningen kommer att läggas på Experio Labs hemsida sen, så man kan ta del av hela det här spännande efteråt också. Men här var det en annan fråga. Går det att uppskatta i runda slängar hur mycket tid ni har lagt ner på det här projektet?
Oj.
Hur många månader? Hur många?
En bra fråga. Vad skulle du säga på? Men jag tänker också att vi gjorde det ju extremt grundligt. Alltså man behöver ju inte lägga så här mycket tid heller. Nu la vi extremt mycket tid på teknologi och väldigt mycket detaljer. Så att, men vi la ju tid för att vi hade ju förmånen att kunna lägga tid för att vi fick finansiering av Vinnova. Men nu vet jag inte exakt på.
We started because first we did already a lot of pre-work to send into Vinnova to be able to get the money.
Yes.
So that was maybe like a month or something. And then I think we started in April and the exhibition was in November. And we probably have worked 3 days a week on it. And then we were 4 or 5 people spending time. So quite a lot of resources, I would say. Yeah.
Yes. But just because we had them.
Yeah.
Men ändå som ni säger, det går ju också att testa mycket enklare prototyper och få en bra effekt.
Ja.
Och ändå kunna få till en bra diskussion.
Verkligen. Så konferensen på Vinnova var väl efter 2 månader och den var jätteeffektfull. Som du sa, att de vågar ju knappt lägga telefonen på pappret, vilket var väldigt intressant. Så att det går ju att få liksom ganska starka reaktioner på ganska kort tid.
Och här kommer en till fråga då. Om ni kommer ta utställningen till andra miljöer eller om det finns andra regioner eller sjukhus som har visat intresse. Och ja, de vill ha den i Värmland.
Ja, vi har ju fått väldigt mycket frågor, men vi känner att det är otroligt resurskrävande att sätta upp det och det kräver väldigt mycket att göra det. Så att vi har kanske inte känt att det är värt den tiden. Och vi behöver också Baptist som är vår teknikperson lägga en veckas arbete på att rigga allting. Så att det är otroligt resurskrävande att göra det igen. Men absolut, det var jättekul, men det kräver ganska mycket att göra det. Och skippa allting. Det är ganska tunga grejer som ska transporteras och hålla. Men vi hoppas ju att själva filmen och all dokumentation kan inspirera. För vi upplevde det på chefsdagen att bara genom att visa den här filmen och gå igenom lite bakgrund att det skapade en väldigt bra diskussion kopplat till projektet. Så att man kan komma långt utan att gå igenom den själv, tänker vi. Även om det är skillnad såklart.
Ja, och som ni nämnde så har vi haft den i Norge tillsammans med norska sjuksköterskor och norska sjukhusledare som en workshop-variant. Så inte hela installationen men som en del. Det funkar också jättebra. Det är ju kanske ett alternativ. Annars är det mest beröm i chatten. Inspirerande arbete.
Nej, men det är väl lite det som Thomas skriver, att det viktiga är ju att man lägger tiden på bakgrundsresearchen. Det är det som gör hela projektet. Att det är otroligt viktigt att man har hittat frågor som man vill ställa. Och det är otroligt svårt att välja också. På där kämpar vi jättemycket med att välja och avgränsa oss. Det är den stora utmaningen. Man hittar otroligt mycket spännande saker, men hur får vi det avgränsat så att det blir en stark upplevelse? Så att det inte blir för mycket och spretigt. Så det la ju väldigt mycket tid och jobb på.
Ja, här är bara en kommentar, tycker jag var bra, som vi lyfte från Sofia. Men att det är också att det gäller att väva in olika perspektiv och inte bara det som drivs av ekonomi eller teknologi. Och att jag uppfattar som att ni har lyckats med det. Alltså att eller vad tycker ni om det? Man kan man på det här sättet väva in flera olika aspekter och flera perspektiv i en sån här komplex fråga.
Yeah, I think also it really lifts a lot of almost philosophical questions. And we noticed when we were, for example, at this conference for precision medicine, where maybe a lot of people, of course, are working on making something possible, making making it possible, and we are maybe more asking the question, do we want this? Or how far do we want to go? But also that in certain groups of people or branches, it's very interesting to ask the questions in this more, raising the ethical aspects of it. And that then speaks to all people, because we all can have opinions or thoughts about how that would impact our personal life.
Var det några reflektioner som gjordes när de som testade preventionsmottagningen kom ut och ni ställde frågorna? Var det någonting som verkligen så här poppade eller som förvånade er att de reflekterade kring eller sa när de svarade på era frågor?
But it was a bit interesting that a lot of people there was many that wanted to know everything.
Yeah.
But then to the question whether they were willing then to change their lifestyle, then they maybe didn't. So that was a bit of a, how do you say, a bit of a paradox or
Yeah.
Yeah. Ja.
Ska se, det kom någon mer fråga här. Så det är David. Vill du ställa frågan, David, eller ska jag lyfta den? David är aktiv.
Fråga, jag har haft så många. Vilken tänker du på?
Jag tänkte på den där man testar att titta på trender, men att det är lättare om man får uppleva trenderna på något sätt. Men du får formulera den själv. Lite hur
Jag tror ungefär så, precis. Jag upplever att vi har presenterat trender tidigare i rapporter, liksom presentationer, men det går ju inte oftast hem, känns det som. Att man upplever det på det här sättet, liksom, eller att man, om man kollar på en film eller Black Mirror eller någonting, bara för att förstå också liksom, känslomässigt vad det innebär, tror jag sätter så mycket mer kan sätta så mycket mer riktning än att bara kognitivt veta att de här sakerna är sannolikt att ske. Jag tycker det är så starkt imponerande det ni har gjort då.
Tack. Och en bra exempel, Black Mirror.
Precis.
Ja, men det var en stark upplevelse. Jag fick ju sluta äta socker efter den här. Som oraklet sa. Tyvärr så höll det ju inte forever. Bara ett litet tag. Man kanske får ta fler piller, tänker jag, framåt.
Mm.
Ja, men tack så mycket. Tack Maria och Pom och alla er som har reflekterat och skrivit frågor och kanske nu skulle kunna gå in och på hemsidan på preventionsmottagningen.se.